Now, I don't know whether you've been watching ITV's new show, Breathtaking. It's a tough watch. It's a moving watch. It's important to watch, though, I think. And it shows firsthand the harrowing reality faced by the NHS, focusing particularly on the early stages of the pandemic.
It's based on whistleblower Dr. Rachel Clark's memoirs. The drama exposes the grim truth of what life was like working on the front line.
I do think, looking at it all, that we can turn the tide within the next 12 weeks, and I'm absolutely confident that we can send a coronavirus packing.
Do you not think it is now right to move to a more substantial lockdown of the capital like they have done?
It is so harrowing to watch. The dramatisation was a reality for the legendary children's writer, Michael Rosen, who, of course, has fought a long COVID battle since then. He spent nearly 7 weeks in intensive care, 40 days in a coma, and is still suffering the long-term effects of the illness. Michael, it's lovely to see you, as it always is when we come in. Of course, Kate has first-hand experience of what there was. You and Derek were on the same ward.
In a coma at the same time. You didn't know you were together, did we? The lovely nurse that treated both of them.
Beth, yes.
Yeah, she came in and spoke with you about how tough things were. And I remember her saying, we did the best we could in such a simple way.
Yeah.
You just knew that there was a whole story behind that sentence. And in some ways, that's what this drama shows.
And she had come across from Great Ormond Street. She had been looking after children, but had been drafted in. Yes, that's right. Yeah.
So how did you feel when you... Sorry, Ben, when you watched
I mean, from my perspective, and obviously I've lived this with Kate and everything that she has been through, and it was harrowing for me to go through, and my wife was watching it and listening, and she said, I think this is too soon for me to deal with this. And our experience of COVID was at arm's length, fortunately for us personally.
Yes.
How was it for you, because you lived that, Michael?
Well, partly because of the style in which they shot it. They were shot a bit like a documentary, that they had setups and then people with steady cams were kind of piling in, and so I felt I was there. Yeah. And I sort of almost like looking round the corner expecting to see me lying in the bed just off shot sort of thing. And then there was one moment in that first episode, I think it was after they'd just shown the guy talking from Italy.
Yes.
Saying what was going on in Italy, and it came back to England. And I just exploded. I just felt like that. I was, in fact, seeing it in the preview cinema. And luckily I had my daughter with me, so she could look after me.
Yeah.
But I just suddenly felt I got the shakes. And I didn't even know why, because it wasn't actually immediately one of the scenes. So I think, you know, these things can have quite a triggering effect if you were there, yes.
Triggering for you, even though for a lot of the time these scenes were being played out, you were unconscious, weren't you? Because you had all very, very sick to not fully know some of what was happening, but obviously have completely lived it through it ever since. And also, I think what we could see is that the terrible, slow unfolding of the lack of preparation and the reality, and the nurses and the health assistants and the doctors all saying what they were seeing, and the disjoint between
That's it. It's the two different. I think that's what upset me, actually, was that they could see immediately people coming in, not being able to breathe, having strokes, embolisms and aneurysms, blood clots and bleeds and so on. And they could see that, and then people saying, well, it's all right, we've got this covered. And then also, another bit that I got upset was when they were getting into bin bags, getting into those orange bin bags.
So these were the health workers, weren't they?
Yes.
Because there was a debate about who should get what PPE, and they actually put bin bags on to try and protect themselves, and were specifically told not to even do that.
Which then led to that scene in the ambulance, which I think first time through I didn't fully understand, which was that the paramedics couldn't resuscitate the guy who'd come into the ambulance because they didn't have the PPE. So there was this moment, and then...
They just had to let the person die.
Yeah, and then you see it on Abby's face, that we're not doing what we're supposed to be doing, which is saving that person.
And a lot of those staff now feel incredible guilt, shouldn't do, but do feel guilt of what they could have done differently, and shock and trauma. And in your way, you have felt, again, you shouldn't do, but you have felt a guilt, haven't you? Tell us about that.
Well, I'm saying it to you, Kate. I mean, is that I hear about people who died. I meet people, you know, I get into a cab and, you know, the cabbie tells me that his relations have died. And then I sort of think, well, why am I here? And I don't even know, because if you go into intensive care, it's not as if you're consciously doing things to make yourself better. You've basically got, you know, I saw it go in the, we see it in the first, see the tube go down.
Yeah.
And then they're just saying, well, now get on with it. You can't give people antibiotics because it's a virus. So they're saying, get on with it. I mean, that's what it is with COVID. And so I sort of think, I'm kind of alienated from the fact that I actually got myself better inside without knowing why. I mean, it's so I do feel quite strange about it.
I mean, it's an extraordinary skill that they have created this really emotive sort of realisation of what Rachel Clark put in her memoir, and then equally what the doctors and the nurses had to go through, and for you to sort of watch it and get a sense of what was going on around you. You know, you're a writer yourself, you're a creative person, but it's a sort of it's a storyline that you couldn't envisage, you couldn't have made up.
No, and I mean, I've been lucky in one sense in that I've got to know some of the nurses and doctors who looked after me. I'm saying me, it's very me, but, you know, all of us. And that's been incredible because if I've met them sometimes in the street or met them in TV programmes and so on, and that's it's good to be able to make that connection, so, yeah.
And how do you feel, Michael, about those doctors and nurses? Because one of the things that really struck me was how difficult that must have been for those healthcare workers that just wanted to save people's lives. And because of government restrictions, because of the health sort of scenario at the time and what they were trying to make them do, sometimes they were stopped from doing what they were desperate to do.
Yes.
And they kept so many people alive.
Yes. Well, it's beyond grateful, isn't it? I mean, if anybody's ever had the experience, they know that somebody has saved your life. That's how I feel, that there is somebody who did stuff to save my life. And that went on for a long period, and then afterwards taught me how to stand up and taught me how to walk. So all those health workers right the way through. And then I realised afterwards, I didn't realise at the time, the incredible risks they were taking. That, you know, I was sitting there breathing, they were looking after me, they were mopping me down, they were doing all that stuff when you're just lying there. Every time that was a risk. They were exposing themselves to what we call the viral load, and inadequate PPE at the beginning, you know, just little paper masks instead of the proper ones, some of them got ill and some of them are traumatised. I mean, I've met one nurse who hasn't gone back, just like we see in the series. Yeah.
2021, an estimated 60,000 NHS staff reported symptoms of post-traumatic stress due to their work with COVID-19, with the pandemic.
I mean, I won't name her, but one of the people who looked after me, she said she hasn't been able to go back. I say me again, sorry, I meant
No,
us,
but of course.
Yeah.
Your time period, absolutely terrible.